Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Dr. Nidhi Jain of the St. Vincent Diabetes and Endocrinology Clinic joins us with more details about thyroid cancer. And thank you so much for being here.
My pleasure.
I really appreciate it.
Thank you.
Now, tell us a little bit about thyroid cancer. And it's not a cancer that you hear a lot about, but it's something that does impact quite a few people.
Well, thyroid cancer is a cancer that develops in your thyroid gland. Thyroid gland is a small gland that sits here at the bottom of your neck, and it forms in cells that are in the thyroid gland.
Is there one group of people that are more at risk than another?
Well, thyroid cancer is not that common. Just to give you an estimate, there were about 60,000 new cases of thyroid cancer diagnosed last year in the United States. But certain people are at a higher risk for having thyroid cancer. Women between the ages of 25 and 65 are more likely than men in the same age group to have thyroid cancer.
What are some of the symptoms for diagnosing this? Because it might not be as easy to diagnose as, let's say skin cancer, where you see a suspicious mole. It's something you can self-check.
Right. Well, thyroid cancer usually starts out as a painless mass or lump in the area of the thyroid gland. That's what leads to the suspicion and then the diagnosis. But some people, if the lump is big enough, they can have hoarseness, where the voice is changed, or if the mass is big enough to where it pushes on the windpipe or the food pipe, they can have some difficulty breathing or difficulty swallowing.
But it would be a painless mass that, you and when I'm just, getting ready in the morning, it's not like I'm going to see.
Yeah, and if it's large enough, you may be able to feel it and see it, yeah, but for the most part, there's no pain.
So tell us about how you go about treating something like this and what we need to know going forward.
Well, the treatment starts with the diagnosis first, so you see a mass or somebody suspects that you have thyroid cancer because of your risk factors. You first undergo an ultrasound, a thyroid ultrasound that tries to locate how big and where exactly the mass is there. And then you undergo a thyroid biopsy, an ultrasound-guided biopsy. Biopsy basically means that you take a little bit of thyroid tissue and then look at it under the microscope to determine whether it is cancer or not.
Now, what are some of the risk factors? You did mention that.
Well, yeah, so besides the female gender and age, some of the other risk factors are if you've been exposed to excessive radiation, whether as part of a treatment of a medical condition, or say from a nuclear plant accident,
And so that's interesting because a lot of us get dental exams and x-rays from that. Does that apply, or is that such a minimal?
No, it won't increase your risk of thyroid cancer at all.
And I'm sure you get that question a lot from folks when they go forward with it. And so when your gland is finally removed, what about the recovery period? Is it an extensive surgery, and you mentioned it can impact your vocal cords before, or does it have any lasting impact?
Well, thyroid gland makes thyroid hormones, which control a lot of metabolic functions in the body. So anytime you have thyroid surgery, especially for cancer, because they do remove the whole thyroid gland, that is the treatment for thyroid cancer. So you do need to take thyroid hormones, to replace the natural hormone that your body makes.
Well, this is fascinating, very interesting stuff. And I understand you also have a new clinic, a new area. Tell us where that is.
We are at 701 North University now.
All right, 701 North University. You can go speak to her. Dr. Jain, thank you so much.
You're very welcome.
Appreciate it.
Thank you.